and other attributes before they will say, okay, we're going to do this to prevent disease. So we're talking about public health psychology. Now, both disciplines are increasingly adopting action research, which combines studying a problem with actively implementing solutions in real time. Again, this implementing solutions is about implementation science. That means no longer about conduct a research is an artifact you live in. We talk about longitudinal studies. We talk about longitudinal studies. You analyze, you analyze, you go. We don't go deeper, We don't go deeper to find out why they have responded the way they responded. And that you may find out when you do a qualitative word research. So today, the end thing is mixed methods research. Let data 3 times in a day. And by night, it may also do what? Change. But when you just do that snapshot, cross-section study, and keep it as artifact, that's why I said from the beginning that our research should be problem-oriented. It should be to solve problems. Because in solving problems, at the end of the day, you have to evaluate. Because you have a program, you have an intervention. At the end of the day, you have to evaluate the efficacy of that intervention you have made. And it's still part of research. So you should think about that. Not just, I have done my thesis, I have done my dissertation, I will run away. No, let it be problem-oriented. At the end of the day, you come up with intervention, which you will evaluate to know if actually I have solved the problem I start to solve. Then the last and not the least there, you talk about implementation science. That is where we are headed. That is where research is now. You had Dr. John Bosco Chukwuoji from Michigan State University talk about this. Others mentioned this. And today again, Dr. Ife Yunwa will still talk about this again. Because this is the study of methods to promote the integration of research findings and evidence into healthcare policy and practice. You have to integrate it. That's why I said earlier that today we've gone beyond that era of you just do a study, you keep it. No. Before you begin a study, you must identify a problem you're going to do. So it's a problem. Then evidence for African countries often relies on multinational data sets or estimates from international agencies such as the World Health, which I mentioned earlier, United Nations. Although these sources are valuable, they are good though, but they may not fully capture the lived realities, the local variations, and data they give us, they are good. And data they give us, they are good, but we have to be cautious while using them, because they may not really show who we are. They may not actually capture the lived realities of Africans, Nigerians, and our local variations. For example, when you're telling a white man about child abuse, the way that white man will see it, conceptualize it, is not the way an African will do that. I remember growing up, after school, you wash your school uniform, they will ask you to go to the farm, go to the market, do that without siesta. But you can't tell a white man that. For a white man, that is child abuse. But in Africa, Nigeria is part of what? Child rearing what? Practices. Can you see? So when you now rely on their data will only reflect their own what? Environment, not our environment. And when you use it for intervention, that intervention, it may or may not be what? Effective. Now, And because of this, we don't have robust indigenous evidence needed to inform local decisions, interventions, and policy development. So for us, it's now difficult for us to actually make that informed decision, that evidence-based decision that we solve our problems locally. That's the challenge. Now, what is the response? I mentioned response earlier. Do we just sit and watch? What are we going to do? That is the response. And because of this, there's the emergence of CAPRA. And what is CAPRA? CAPRA is Center for Applied Psychology and Public Health Research in Africa. And I am one of the directors. What is CAPRA up to? CAPRA is to help us have quality data that have integrity. Then in conclusion, for and sustain implementation science in Africa, especially Nigeria. Because at the end of the day, when we do all these things, if you don't use the evidence to solve our problems, that means we have done nothing. Whether in psychology, whether in public health,
psychology will have a question to ask about this. Clinical psychologists will have a question. Scientists will have question about this. So I want to think about a phrase, think about a word, think about something that can represent the question you ask. And in the next slide, I want you to scan the code. So scan the code, and it takes you to where you just put in the words you think. Let's see what comes in people's thoughts about the same bottle, the same jars of juice that we saw in the previous slide. So let's do that within the next couple of minutes. So yes, costs. Okay, please let's continue bringing in the response. Just scan the code and just drop anything, any phrase, any word that comes to your mind uh, that describes the question you could ask if you are working with that product. Yes. In psychological science, asking from the process of bringing this to life. We have people in even along all the intersections in the supply chain, asking questions about this. So these are different things. So this tells us that one social issue, will have different people to ask questions about, and many data collected hinge on data. Advancement of knowledge, theory development, social development, implementation, treatment, whatever, intervention, everything, teaching, and everything depends on data. So, but the issue is that most of the data at our disposal tells stories about other people. So data from the West, data from foreign NGOs and stuff like that, tell stories about other people and not basically telling stories about us. So, and then we have many studies are flawed due to data. Some of them are because of instrumentation. Some of them are because of transmission and storage of data. Some of them are because of contemporaneity of data not being collected at the time that it's needed or at the time that it is very useful. So many studies cannot be reproduced. Baker in 2016 conducted a study with 1,500 researchers, and about 70% of the researchers were unable to replicate another scientist's study. So, and then out of those 1,500 researchers, 50% of them, that's about 750 of them, were unable to reproduce their own study. We found some data issues or data-related key factors that can cause crisis of reproducibility. And some of them is the pressure to publish that we have today in the academia, which is the usual publish or perish culture that we have. We have low statistical power. We have people who have samples that are very small, are related to data of not useful at the end. So it has a lot to do with where the data is kept and what the data is used for and who has access to the data and a lot of that. So now, well, let's look at some issues with poor data quality. So a lot of issues comes up today that define or that step us up to understand how we have or why we have. So poor data quality today might come from self-report or recall bias. I did a study in the past that had to ask questions about about what people went through when they were much younger. Now, you will agree with me that some of these studies that has to make people think back and remember what happened in the past may have recall bias. So people may not recall well what exactly happened. Elizabeth Loftus, who was the primary person. Here we have proxy response, but here we have proxy response, but here we have others of people who collect data from people who are not able to read or write. We have respondent issues like streamlining, careless responding, speeding, satisficing, and all the rest of them, which are issues that come from respondents that respond to survey instruments. And today, the big elephant in the room, the AI, artificial intelligence. So today, one of the reasons we may not trust data that is in our disposal is because of AI influence. So perhaps the data you are talking about, if you were not part of the collection, or if you cannot tell story about the credibility of data, it could be AI generated data. So today you can tell AI, maybe ChatGPT or Gemini to generate a data for you, and they will generate the data for you. So you can tell ChatGPT to generate a normally distributed data of about 5,000 participants responding to a particular instrument. These are the variables you want in it, and it's going to generate that data and have that normally distributed. And you will think work is done. So that's why advisors, supervisors should be able to be more engaged in data collection when their mentees are collecting data, because at the age we are into, bot response, AI, and deepfake can bring in a lot of things that we think are real data that represent a particular population on Earth, but that does not represent any population. Then we have measurement errors that come from unvalidated scales and uncalibrated or poorly calibrated instruments. And we have attrition and missing data issues that are akin to most of longitudinal studies. That when some studies start, the people, as long as the study lasts longer, you have some people who maybe by death or by loss of interest in the study, they were dropped out of the study, or they dropped out of the study. So sometimes when the pattern is actually affecting a particular set of people, it's going to be a big issue when the data turns out. Just like what is happening today in the US with immigrants, and immigrants feel so targeted. So most institutions, IRB, collect from everybody on the mean income that we have, a certain percentage of the mean income of everyone in the room. And then we happen to collect the data from the professors in the room. So you see, these are the people with the professors and directors in the room who have the highest salary range amongst people in the cultural weight of the instrument and how they might be useful, or usability of those instruments in their own culture. And that's one of the issues. So sometimes when they say they adapt own culture, and that's one of the issues. So sometimes when they say they adapted reliability and all that, there are so many processes with adaptation that brings an instrument from an existing culture and domesticate it in a particular culture. So we have lots of culturally responsive measurement tools that gives us flawed data, register them on some sites so that they can take surveys and get paid. Now the problem is this, So when people look at some of these paid platforms, what they come there to do is to they actually come to struggle to earn money. So when they look at it, to struggle to earn money. So when they look at it, that if they put in their time, they can respond to up to 10 surveys within a day, or 20 surveys within a day, So, and they've seen that the 20 surveys or test. Surveys is going to give them about, let's say, $50 or whatever it's going to be. And they'll say, oh, that's lots of business. That's cool. So if you transact very well, you see that's about 70,000+ naira a day. And that's a lot. So you are going to be making minimum wage within a day. So some people will begin to expand that way. So some of our people, especially the Igbos, and our Nigerian mentality will begin to play out, and people will begin to duplicate their participation. So and respond only 10 or 5 surveys in a day. Say, and I can respond to about 20 or 10 open different accounts with different emails, different phone numbers, okay? And then when you do that, you have the same person responding to the same data set at different times. And then that begin to create some synthetic identities and all that, and that begin to compound the data. So you have a data set, and you think you have 1,000 participants, but you have about 600 to the data. They are just clicking. So, and most times we use that to, and we see poor data quality does a lot of harm. It affects a lot of things. It affects revenue, it affects intervention design, it affects treatment outcomes, it affects policy recommendation, it affects text theory development, it affects public trust in science and reproducibility or replicability of studies. The US alone recorded 3.1 trillion loss in revenue that is owing to bad data. It's from Harvard Business Review. So you see, bad data, poor quality data can actually lead to a lot of issues, including loss of revenue. So, but then high quality data does not equal high integrity data, because the security of high quality data can still be breached, can still be compromised. And then highly secure data might just be a trash. So somebody might secure a data very well, but at the end, the data you secured was actually a trash. So, and then you have some good instruments can be used wrongly, and then some bad instruments can be administered exceptionally. And then we have complete data sets that are still fabricated. So like that deepfake generated, but that's very complete. And you have some data sets that are wonderful, but still they are too small to make an inference. So high quality data does not equal all the time high integrity data. So we have to look at different things that talk about quality of data. But before I go on, I want to be sure that you are still with me in the room. Hello, are you still with me here? So we have different data quality and integrity frameworks. We have the APA ethical principles that emphasizes accuracy in reporting, avoidance of data fabrication and falsification. We have proper record keeping. We have participant protection. So most of us will be aware of these APA ethical principles from the APA, most recent APA manual. And we have the open science framework that emphasizes key principles like pre-registration, transparency, reproducibility, open data, open materials, replication, and all that. That's from the open science collaborations, and which is from the leading work of NOSEC in 2015. And we have the total survey error.
Non-commental.
So what did they do? They had that developed as the technical existing platform that the university, and now they will be referenced because their data were used. So this is what we are trying to replicate here. We are trying to see if we can reduce the bastardization of data collection among students, especially undergraduates, and rather train postgraduate students on how to really understand data and how to collect data, how to use data. So this is just to make it easy for everybody to understand what we are trying to do. Now, why I'm complaining, especially Nigeria has so many platforms that, should I use the word pretend, that say they collect data, they are repository for data, especially like the NBS, the Nigeria Education Repository Database, Data Bank, the open. You come to, this is GCRO, that's the Halton City Region Observatory Quality of Life Survey. This is where a city, this is not a country, this is not a state, this is just a city collecting data on a regular basis to help decision making in the city. It helps in the planning policies, you see that every questionnaire you respond in, people respond to in this city has an implication in the way policies are made, in how it push, because quality of people's life are affected. You know, Dr. Godwin mentioned about the health and aging studies. This is a replication of similar one in Africa. This was done in South Africa. This data is what a lot of people take. Like personally, I have used the data to, I've written a lot of papers from these data sets, meaning I don't need to go to the field. The data is considered credible, the data is considered replicable, meaning if you publish a paper or you collect data and it cannot be replicated, it has a lot of problem. That is what Dr. Godwin was explaining all about. So now, due to time, I've just, this is not, I'm not going to cover most of the things on my slide because of time. But what we are trying to introduce here, we're introducing Resona Data. So this is a platform for students and researchers, students, lecturers, whoever is interested in data. We have built a platform where students can easily respond to data, and all the things that Dr. Godwin described, we have embedded them here to make sure the data you collect from the platform of high quality. So part of what we are doing now is to encourage postgraduate students to engage in collecting quality data, and we are building the community to make it easy for you. So we expect you all to go to resonadata.com. You can register as a participant. You can register as, you market it in this way because as a participant, you will make it easy for researchers to reach you. And we're trying to take serious cautionary measures to ensure that quality of the data these researchers get are of optimum value. Now, for the researchers, we expect researchers to be institution-based. We are interested in ethical data collection. There are a lot of checks we have to ensure that people's information, their data are secured. So we're trying to follow all the principles to ensure that whatever people get here are actually proof and good. So we are actually trying to discuss with organizations, especially institutions, such that they will have a subscription that will cover all staff and students. This is where, just like Dr. Godwin explained earlier, where supervisor and students, we monitor the kind of data they get. And so the way it is done, we might need to organize another demonstration, another program where we would explain and teach people how to use it and how it can be used. Secondly, Capra is a platform where I know probably some of you, especially students, all the things Dr. Ifeanyi was saying, Dr. Godwin was saying, seem to be sounding Greek to you. But these are skills that you need. I believe many of you in your first year or second year, they told you a psychologist can work anywhere. Yeah. Well, it's true and it's false. It's true, but you have to go to what I was saying.
Dr. Ejike, we got you.
Okay, good. So I'm trying to run through the charts. I'm trying to run through the charts to see because, my plans have been a bit disorganized with the timing. So what we all plan to do today, we plan to cover a lot. But as it stands now, it's unfortunate that we will not be able to do that. So please, if you have any question, I'm going through the charts now to see the engagements we have here. And unfortunately, there is no engagement. I don't know, Dr. Adobe, what can we do?
Okay, Dr.
Because of
Ugu,
the
I
time,
can hear you. For question, a student is asking if they can register on Resona
Yes.
Data as both a participant and a researcher. Is it possible for them to, have that dual identity where they can make money from, submitting information and also benefit as a researcher?
Yes and no. Yes, in the sense that for you to register as a researcher, you need to.
He's on the chat. So see if there is any exercise.
Can you hear?
Undergraduate students, people don't want money.
Dr. Adobe, can you hear me?
Yes, Dr. Lawrence, I can hear you. And there is another 50K hanging in the balance. So if people are not participating, you are missing money. So participate with this one. There is also another one, and that is for 50,000 naira. So who is on the Zoom link now?
Yes, you can get data. As a student, you can get data, but you need to register as a researcher. So that's why we want you to have institutional emails. So I believe, I don't know those who are responsible, but you can get institutional email from the school. Yes, as a student, you can.
So students, if you are interested in registering with Resona as a researcher, you can go to the ICT unit and see if you can get an institutional email. That's the only way you can get data. So instead of moving around trying to get people to fill your questionnaire, you can just get data from their repository. So have you seen them on the link now?
Yes, I'm seeing the charts are coming in. So
okay.
As you pay on the platform, yes, we have a.
Okay, Dr. Lawrence, are you here?
Yes, I'm here.
Professor Eya is here. Say hi.
Oh, Prof. Mommy.
Lawrence, how are you?
I'm fine, ma. I'm fine.